Treasurer Dale Folwell called out nonprofit hospitals across North Carolina today, including Novant Health, for what he calls the cartelization of health care.
A new report shows top-level executives in those hospital systems made nearly $2 billion in the past 10 years. The CEO of Novant made the average wage of a North Carolinian in just 35 hours of work. And after the sale of New Hanover Regional Medical Center to Novant Health, the former CEO, John Gisdick, netted $1.75 million from Novant. This while Novant raised the minimum wage throughout the hospital system to $15 an hour, costing around $4.3 million.
The report says that's less than what the hospital system pays its CEO every year. With a nursing shortage across the country, the report shows that just 1 hour worked by the 18 CEOs in the state could pay 459 minimum wage employees for that time. The treasurer says the pay discrepancies and the lack of transparency is just unacceptable.
We're simply after the hospitals of North Carolina to stop giving the middle finger to both the current and the previous president of the United States when it comes to healthcare transparency.
The North Carolina Healthcare Association released a statement responding to the treasurer's news conference. You can read that entire response inside this story on WECT.com.